So, what exactly is conflict resolution, especially when we're talking about in a large hospital workplace setting? It's mainly if it's a conflict and you don't resolve it, you let it escalate, it can cause problems in many areas in the workplace environment. And so, um, looking up something on conflict resolution, I noticed a lot of, I'm going to call it toxic positivity type deal, where most just look at the nicer side of it, just don't talk about the real horrible stuff of conflicts. Just keep a positive attitude. And I feel as though, me personally, I feel as though that's unrealistic. And I think it's better to talk about the hard things and the hard situations that have happened, so that it's better addressed and won't shock people as much when those hard situations come out. Like de-escalation tactics, dealing with difficult patients and employees. And so, let me, I'll say this first, and then I'll read the other, examples that I have read about. But I want to share some things that are horrible that can happen, and has happened in the workplace environment. You can Google it, you can see certain things, but a lot of times when bad stuff happens, we either sweep it under the carpet, we don't want to talk about it because it feels uncomfortable. We just want to get it over with and assign it to the players, the team players that deal with those problems, get it out of our hands and just, go on with our happy-go-lucky position within our position. And so, say for example, conflict resolution between employees and patients, or patients come in, they don't get their way, and how sometimes we're talking about a man against women, right? And in this case, I want to say it's never one gender, it's never one race, it's never one political party that someone believes in, it's never one religion, things of that nature, And so if you have somebody come in and they want to don't get what they want, or they're very upset, or they receive a critical diagnosis, they can do things and which they can be held accountable for, but these things, while they are being done, it's like, how do you handle something like this? If a man comes in and he sprays the wall with body fluids, in front of everybody, and just, you just sprays the walls and stuff like that. Or if it's a female, they reach into their clothes and take out something that's bloody and throw it at you. Or if you have employees that will threaten with weapons, or get so upset to that extreme. And so it's good to deal with the smaller problems before they become big, but sometimes we don't know how to deal with difficult people, and we tolerate difficult people. We enable some of us make excuses for difficult people, and before you know it, postal situations occur. And so there are mechanisms in place. You know, you have your police and security teams to help out, your combative teams, your codes or whatever to call for combative. But paying attention to conflict resolution within a large hospital workplace environment is very important, because it plays with the morale on co-workers that we work together, and as well as patients that come in and see these things and how we deal with them. So I'm going to talk a little bit here about conflict resolution and what I've come up with so far.
Conflict resolution is never easy, and I think this is why it's a huge deal, is because many people talk about it in a toxic positivity, one of those, I'm going to use that phrase, a toxic way, to just blow it off, you know. But here, it requires experience, I think. The longer you've been in a when I'm talking about the hospital setting, a large hospital setting, the more you get involved and don't shy away from situations and learn how to deal with those situations that come up and help others deal, that you work with your coworkers and help them through difficult situations. This one is very difficult to talk about for many reasons. So I'm gonna give here an example. Understanding conflicts in a healthcare setting. I'm reading something here. Dealing with difficult patients, challenging situations involving coworkers. It says it's essential to recognize the potential for conflict and to develop strategies for resolutions. So here, I typed in an example. Give me an example of this. I do know and very familiar with this type of an example. Here's a scenario. Managing difficult patients. So when you're assigned as a sitter for a difficult patient who possesses a risk to themselves or others, your primary responsibility is to ensure their safety. However, if you find yourself in a situation where your coworkers are unhelpful or unresponsive during a critical moment, such as when the patient attempts self-harm, there are several steps here, it says, that you can take. Where are my glasses? Oh, here we go. You want to assess the situation, quickly evaluate the immediate risks involved. In these situations, when you're sitting with the patient, you're trying to avoid them harming themselves or harming staff, harming others. Determine if that patient is in danger of harming themselves or others. Communicate clearly. Use clear and assertive communication to alert your coworkers about the situation. For example, calmly state what you observe and what actions need to be taken. Phrases like, "We need help here," or "This patient is at risk." I need assistance immediately, can convey urgency without escalating tensions. These words say all that, but when you're in the situation, it does not happen like that. It all depends on who you're on duty with. And again, you know, it's one of those things where okay, you ever come into work and you're like, oh my God, who am I working with today? It's one of those things. And you get to know your personalities and behaviors, or who you can trust in that situation, or who you can go to for help when you need help and assistance, and who you can help when they need assistance. You know, is one hand washes the other. And so also when you're taking care of difficult patients, some people, it depends on behaviors and personalities. Some people will antagonize patients and make them more aggressive or more frustrated than what they are. Depending on your personality and behavior, you might be able to, the things that you say to the person and the way you talk to the person, may be able to calm them down in ways, and the things that you do. So all that comes with practice and experience, and not shying away from dealing with it and complaining about why is this person this way. I mean, you take the job, you want to work at the job, but you don't understand why patients come in the way that they do. Another thing is, if you're working in like surgery or something like that, and it's critical, sometimes you'll say, well, this doctor is real nasty, and they're real strict. But see, if you know personalities and behaviors, some of those doctors that are labeled like that, I love them so much, because it's like they will yell at you, get me my labs, get me my x-rays, get me my this, get me my that, because they're trying to, they will do whatever it takes to save a life. And whereas some people, and they know some of the co-workers and the staff that they work with are not going to get off their tails and get what they need right away. They're going to take their time to get it. And some co-workers are not going to go for that. And so then you start labeling people as nasty, and you're not going to do this and you're not going to do that for them. So all that plays a part in conflict resolution. And then you have mistakes that happen easy. You don't have the support that you need when it's time to go into surgery and perform certain procedures, because you're with some crappy staff. So I think all that falls under conflict resolution as well. It says utilize available resources. If your immediate team is unresponsive, consider reaching out to other staff members. So some people just want to sit there on their phones, or they ignore you, or they like to complain, or they like to talk about other people 24/7. I always say, find your like-minded people. Even in these situations is very, very important, because you're dealing with lives here. Know who you can call. I'm going to leave it. Okay, it says something here about systemic issues. In cases where systemic issues contribute to conflict, such as insufficient support, staff leading to adverse outcomes, For example, medical errors is vital to advocate for changes that enhance workplace safety and improve patient care. So if you can speak up, or find those that are around you that you trust to speak up, that might can speak up about wrongdoing and errors that are happening. I'm not going to harp too much on this at this moment. This is a very, very touchy, critical topic, conflict resolution, which can be done, but it's a lot of hard work. All right.